To you about a question that I've gotten a lot so far this week. It is exercise safe during my pregnancy? So we're going to talk through some different things that relate to exercise in pregnancy. And the simplest answer is yes. For the vast majority of people, exercise is safe during your pregnancy, and it is a wonderful thing that you should be doing. So let's dive into it a little bit more. So unfortunately, a recent study has shown that only 1 in 4 women get enough exercise during their pregnancy. And there's just a lot of factors contribute to that. Sometimes it's fear of the unknown. Sometimes it's just women are going through, their bodies are going through so many changes during their pregnancy that they're just not sure what they should be doing, not sure what they're feeling. Oftentimes women can get discouraged because of those changes that they start to feel and see in their body, and they can just kind of wonder, what's the point of exercising? I'm just going to be pregnant and get big and I'll deal with it afterwards. And so a lot of women may have that attitude of, I'm not going to make any progress, so it's just not worth it. I'm here to tell you that it is worth it. So, because what you may not know is that moderate, comfortable exercise during your pregnancy and focusing on good nutrition can actually give you more energy and can lower the rates of gestational diabetes, hypertension, and depression. So movement is medicine. And so we want to find comfortable ways that you can move and exercise. So simple answer is yes, exercise during pregnancy is safe, and it can lead and help you to have a healthier pregnancy. So some of the main benefits that exercise gives us is that exercise helps to reduce the amount of cortisol, which is a stress hormone, and so it reduces this in the body, and this helps to kind of keep things a little bit more even keel and allow for a good healing and good energy levels. And another thing that exercise does is that it's going to help to boost muscle and cardiovascular strength. So again, your body's going to be going through lots of changes during this pregnancy, and so we want to make sure that we've got good muscle strength, we've got good endurance, because your body needs to be in this for the long haul. So you're going to need that extra strength to carry that extra baby weight that you're going to be putting on with the pregnancy. So what are some of the best exercises that you can be doing during your pregnancy? And I'm going to come back to one of my common answers is it depends. It depends on what your fitness level was prior to getting pregnant. So many women may use the pregnancy as a time to think about starting to be more healthy and more active. And that is a great thing to do. Don't feel like you have to shy away from exercise, but this may not be a time to start training for a marathon if you've never run before. So you want to think about probably engaging in more lower impact activities such as swimming or walking, biking, maybe using an elliptical machine. All of these things have a little bit less impact to the body. And why do we care about that? Because during our pregnancy, our ligaments are going to be loosening up on us a little bit. And this can make us a little bit more susceptible to injuries. So we want to make sure that we've got good support, and it's an exercise that's well tolerated by the body. So I get a lot of questions from runners is that asking if running is safe during pregnancy. And again, runners should be aware that those loosening of the ligaments may make them more susceptible to knee and ankle injuries. So we want to make sure that you've got good supportive shoes and that you've got good running form. And ultimately, if you have already been running, it's probably okay to continue running during your pregnancy, but you might have to decrease your time or mileage to make it feel more comfortable. And there might come a point in your pregnancy where running does not feel comfortable anymore. I frequently recommend wearing some type of support garment to help give some compression and support over the pelvic area while you're running, because with, again, the loosening of the ligaments and muscles getting kind of stretched out, the repetitive jarring of running can cause some extra pressure down through the pelvic area on the pelvic floor. Potentially can lead to a condition called pelvic organ prolapse, where the organs start to kind of descend down. So in order to help support through that, wearing a compression garment and support garment while you're exercising, especially as the pregnancy progresses, may be very helpful. And one of the brands I recommend to my patients is through a company called SRC Health, and they have all different kinds of options there. I think their website's actually srchealth.com. So you can check them out there. But yeah, wearing some support while you exercise is a good thing. One thing that I often tell people, as far as a general rule of thumb, is don't force through pain. Okay, if something's not comfortable while you're exercising, then stop. Okay, this isn't a time of no pain, no gain. Now you have to know the difference between muscle burn and fatigue and pain that's problematic. So it is normal, especially if you're working those muscles, to have some burn in them, maybe some soreness for a day or two afterwards, but it shouldn't be severe. It shouldn't be intense, and you should be able to recover quickly from it. So if you're experiencing more intense pain or severe pain while you're doing something or shortly there afterwards, please stop and consult your healthcare provider about it. I find that a lot of women find like kind of a prenatal yoga class to be a very helpful and comfortable thing. And I recommend that wholeheartedly for people if yoga is your thing. Again, just watch that with the loosening of the ligaments, you are definitely most women are a little bit more flexible during that time. So it's not a time to be trying for personal bests and stretching to end range. This is time for moderation and taking care of our body and going to comfort. So again, if you're experiencing pain or problems with any particular exercise or activity that you're doing, it's a good time to consult your healthcare provider. Okay. So if you're new to exercise, maybe you haven't been a runner, you haven't been very active, then definitely need to start more low key. Honestly, getting out there and walking is a great form of exercise. If the weather is not permitting it, kind of like it is now in St. Louis, then I would recommend going to like an indoor track or walking the mall, something like that, where you can get a little bit more activity that way. So don't discount walking. It is a great form of exercise to help build up endurance that way. It is safe to lift weights during pregnancy. Again, we don't want to, this isn't a time to try and set a personal best for how much weight we can lift, but it is definitely okay and a wonderful thing for you to continue to build up muscle strength by doing moderate weightlifting throughout the pregnancy. Things to avoid are really hot yoga or hot Pilates. We don't want to do any type of activities during pregnancy where we're really raising up that core body temperature externally. Research has shown that just the amount of temperature change that happens with normal exercise is perfectly safe, but we don't want to be in kind of those artificial situations where we're raising up the body heat, like a hot yoga or hot Pilates. Again, not sitting in a sauna, not doing a hot whirlpool type situation. So those would be things to avoid. If you're having trouble being as active as you want to be, or continuing on with activities or exercises that you used to be able to do, then it's a good time to partner up with a women's health physical therapist to help evaluate how you're moving, what your muscles are doing, and how you can continue to be as active as possible. Maybe we simply just need to make some modifications to how you're performing your exercises, and then it'll be more comfortable. Maybe we do need to scale back, or maybe you are able to kind of do a little bit more than you thought you could. You just needed some guidance with how to do it. So that's where working with a pelvic or a women's health physical therapist can be very helpful, or working with a personal trainer who is experienced with working with pregnant clients. So that's definitely something, if you are going to start working out more and you want to work with a personal trainer, you want to know how many pregnant clients that they've worked with in the past. Is this something that they specialize in? Just so that they know about some of the modifications and things you should be watching out for.